That is the ethmoid bone. And what is it highlighting?
The perpendicular plate.
Perfect. That's a perpendicular plate. It runs perpendicular to the main axis of the ethmoid bone. And it separates what two structures into right and left? It goes right between and separates the medial nasal concha into the right side and the left side. Okay. What bone is highlighted? That one should all get.
Mandible.
Mandible. No one should miss that in my class. Okay, which one's highlighted here?
Mastoid process.
Mastoid process. And that's known for what's inside the mastoid process?
Air sacs.
Air sacs. Honeycomb appearance of the bones. It gives a skull, it's lightweight. And let me see if I got that. Yeah. Now, something just interesting as a byproduct here. You see that first molar with that? I can't really point to anything here on this because it won't let me. But you see how there's roots in that second molar? You can see there's an O between there. That's where bone loss has occurred. Now you got between the roots. See, the person about a 50% bone loss on those molars.
What causes all this bone loss?
Periodontal disease, buildup of calculus, things like that. With adults, you build up calculus at a greater rate because of the enzyme content and the acid content of your saliva. Okay? Different foods that you eat, and it can cause bone loss in there. Because bacteria get into underneath the gums. If they don't get cleaned out, they form calculus, and calculus eats away at the bone. And that's what, and you got to see the dentist about every 6 months. Most people get that calculus scaled out of there, or else it builds up. There's something you can't get out with a toothbrush. Once it solidifies, it causes destruction of bone. That's the plug to see your dentist. What structure is highlighted? I don't see anything highlighted. Oh, the little opening right there. The little hole is highlighted. Okay, that is which one?
Foramen, what was it? Foramen, I can't say that word.
Foramen spinosum.
Spinosum? Turn off the highlight. Foramen spinosum. Yep. Okay. And what bone is that?
That one is
not the occipital bone. Look at the picture in the upper left-hand corner. What's the shape?
Butterfly.
Butterfly. So what bone is it?
Sphenoid.
Sphenoid bone. Perfect. Okay, what bone have you there?
Parietal.
Parietal. Perfect. Okay. When you're doing exams like this, on my tests, your nursing exams, your N-class exams, look at the other answer. Just in case you don't, you know where the occipital bone is, right? It's in the very back. You know where the frontal bone is. It's in the very front. You know, the temporal bone is low where it connects to the mandible. There's only one left. So it's got to be the parietal bone. Okay. Most of the times, even if you don't know it, you can eliminate at least 2 or 3 of the answers. The highlighted structure is a feature found on which bone?
Zygomatic.
So there's your bone. So which bone is it on? Zygomatic bone?
Temporal bone.
Or the temporal bone? It's a process of it. Okay. The correct answer would be the temporal bone. It's the process of the temporal comes out. The other side is the maxilla. The temporal bone forms the posterior arch. The maxilla forms the anterior arch of the zygomatic arch. Okay. So the maxilla forms the anterior part. The temporal bone forms the posterior part, and that makes up the zygomatic arch where those two come together. Okay. So that's your temporal bone. Okay. It's a feature found on which bone? If you highlight the front part of it, it'd be the maxillary bone for the zygomatic arch. Okay. Which of the following bones articulates with the highlighted bone?
Temporal bone.
The temporal bone. Perfect. It's showing the mandible. The mandible articulates in the mandibular fossa of the temporal bone. Correct. Which two processes are located superior to the highlighted structure? Okay, so which two processes are located superior to the highlighted structure? Superior, above. Okay? So look at the region above it. Would be the mandibular condyle and the coronoid, mandibular column and the mandibular notch, the alveolar margins and the mandibular notch, coronoid process and the alveolar margin. Now,
The first one. Mandibular condyle and coronoid process.
right, but I would say the second one too, the mandibular condyle and mandibular notch.
Well, this is getting us ready for the NCLEX because there's all the answers are correct. You have to find the most correct one. So
Okay. We'll go with the mandibular condyle. Because mandibular notch is between the condyle and the coronoid. So not a great question, but they want the mandibular condyle and coronoid process. I guess they're considered structures, whereas it's a landmark for the notch. The most correct one is the mandibular condyle and the coronoid process. Got it. Which of the following is not a feature of the highlighted bone? The hypoglossal canal, the styloid process, the foramen magnum, or the external occipital protuberance, which is not part of that bone. First of all, what bone is highlighted?
occipital
Occipital bone.
be the hypoglossal canal.
No, the hypoglossal canal runs through the occipital bone right by the foramen magnum.
The styloid process.
Styloid process, we could do that. I think it is the external occipital protuberance. I think that's in the temporal bone. I would say external occipital. Let's check it. Incorrect. It's the styloid process. You were right. The occipital, the styloid process is part of the temporal bone. The what did I say? It was external occipital protuberance is part of the occipital bone. I thought it's part of the temporal bone, to be honest, but I'll have to go back and double check. All right. Any questions on that one so far? Like I said, if you go back and do the quiz again, it's going to go back and give you just 20 different questions. So it's a real good study aid. You can also do what's called the lab practical, which shows you different things. So you have to type in your answers. Like your framing right there, you'd have to type in the answer for that. And it just gives you different things. It points to different structures. And you get to come up with it on your own. So it's good practice for the practical. And there's your sutures, your frontal, coronal suture. I'm sorry. That's your coronal suture. Okay? So any questions on the skull?
There's a lot
We
of
all
them.
got it.
Coronal or the sagittal?
What's that?
Is that the coronal or sagittal suture?
That's a sagittal suture. What did I say?
I think you said coronal.
Oh, no. Okay. It's sagittal suture runs between the parietal bones. You're right. That's the sagittal. Coronal runs between the frontal and the parietal bones.
Yeah.
Yeah, that's the sagittal suture.
I think of it as like where a saddle would go.
There you go. That's perfect. It's a good analogy.
Why would you have a saddle on your head?
No, just in
Saddle, no, yeah, not there. Saddle between the two bones. All right, so we got the skull. We start with the vertebral column and then the thoracic cage. We'll do about 15 minutes, and then we'll take a break on this and go back with that. So, review vertebral column. Okay, this is our vertebral column. The vertebral column is made up of vertebrae. The vertebrae have spinal processes. The spinal processes point to the posterior section.
Spinous processes.
Okay. You have the intervertebrate foramen. Those are the openings, the hole formed by the
Intervertebral foramina.
Okay. Formed by the intervertebral arch as a vertebra come together. That's where the spinal column runs through. You have your intervertebral discs. Those occur between every vertebrae. And those are not fluid filled. They're cartilaginous pads that help to protect the vertebrae from shock from jumping or running or bouncing. Then you have the sacrum, or the sacral curvature. Remember, there's 4 curves of the spinal cord. There's a cervical, thoracic, lumbar, and sacral. Those curves allow you to balance and to walk. Okay, so you see the cervical vertebrae are 1 through 6.
Cervical vertebrae and curvature.
Okay, are your C1 through C7. Your thoracic vertebrae
Thoracic vertebrae and curvature.
are T1 through T12. Your lumbar vertebrae are L1 through L5.
Lumbar vertebrae and curvature.
And then your sacral curvature. I thought I was going to say
Sacrum
Oh, there it
and
is.
sacral curvature.
Okay. And that's your 3 to 5. That's your 3 bones that are fused to form that. All right. Looking at it posteriorly. Okay. Pointing at you, you can see the spinous processes.
Spinous processes.
Those are the parts of the vertebrae that stick straight out the back, straight posterior. The transverse processes go to the side. Okay. The sacrum is the bottom part there, which is your 5 fused vertebrae. And then below that would be your coccyx. You have a median sacral crest or ridge on the sacrum, which runs right down the midline. You have your lumbar vertebrae, you have your thoracic vertebrae, and you have your cervical vertebrae. Again, C1 through C7, T1 through T12, L1 through L5. Okay. This is a typical structure of the vertebrae. This is the atlas. This is C1. This is the first cervical vertebrae that connects to the occipital bone of the skull. Okay, you have a posterior arch and you have an anterior arch.
Posterior arch.
Okay, and an anterior arch.
Anterior arch.
Okay, you have your lateral mass to the side.
Lateral mass.
Okay, and you have a transverse foramen.
Transverse foramen.
Which is a foramen for opening on the side of the vertebrae. Then you have a superior.
Superior articular facet.
Okay, that's where the next vertebrae fits in. You have a superior articular facet. That's where the vertebrae connects to the occipital bone. Then you'll have an inferior articular facet on the other side. And the next vertebrae below it has a superior articular facet, and that fits into that. So the superior articular facet connects to the occipital bone or occipital condyle. That's the top part of it. Transverse processes to the side. And that's all there is on that one. Okay. This is the upside down view of it. This is the bottom now. You look at the inferior articular facet.
Inferior articular facet.
Okay. That's where the axis C2 connects with C1. The superior articular facet of C2, the atlas, connects to the inferior articular facet of C1, the atlas. Okay, that's where they connect. Again, you can see the transverse processes on the side.
Transverse process.
Posterior arch, anterior arch, the inferior articular facet, and the transverse foramen. Okay. The axis is C2, the second cervical vertebrae.
So I had a question as we were looking at this.
Huh?
So with spinal stenosis, I get it. It's the narrowing of the column.
Right.
But what is that? What narrows it?
Usually arthritis, which causes bone growth, because our arthritis is bone growth between the joints. And what happens, you see the vertebral foramen, which is real large right there.
Vertebral foramen.
Okay, that starts to get narrow. The spinal cord, the nerves run through that vertebral foramen. As you get arthritis from either injury or things like that, that fluid starts to shrink. It doesn't shrink up at the top, which is really large, but down to the lumbar vertebrae, where it usually starts to shrink, that's where you get nerve pain, sciatica. That once that foramen starts to shrink, the nerves get pinched. And when the nerves get pinched, they trigger it and they get a painful process that continues. But that's spinal stenosis, where you get shrinking of the vertebral foramen and it starts to impinge upon the nerves. Does that make sense?
Yes, thank you.
Yeah, no problem. Again, so you have your spinous process. The spinous process always points what? Anterior, posterior, medial, or distal?
Distal.
Spinal process always points directly back, posterior. Spinal process is always posterior. Transverse processes always point to the sides. It always points back away from your spinal cord or back away from your body. Lamina is a portion of the bone there.
Lamina.
Okay. You have the inferior
Inferior articular facet.
Okay. And the superior articular facet.
Superior articular facet.
Okay. What vertebrae does the superior articular facet articulate with? Remember, this is the axis. So the top part's going to articulate with what? What bone?
The atlas.
Perfect. The atlas. Exactly. That's where it comes out against it. The inferior articular facets going to articulate with what? You have to give me
The
the number.
C3.
C3. Perfect. Because the axis is C2. So those are superior and inferior articular facets. That's what they articulate with. You see the pedicle on the side here also?
Pedicle.
Okay. And your transverse processes. Perfect. Did it switch? Yeah. Okay. Again, your intervertebral foramen. And we'll see when we get down to the lumbar ones, you'll see that that vertebral foramen start to shrink and get a lot smaller. So when arthritis hits, that bone growth starts to occur and can really shrink that foramen. Okay. You have a spinous process. Spinous processes always point
Spinous process.
posterior. They point straight out the back. The transverse processes, you see always transverse processes always point to the side.
Transverse process.
They point laterally. And the transverse foramen runs through that for accessory nerves. You have the main body of the vertebrae.
Body.
Okay. And your inferior articular facet,
Inferior articular facet.
which articulates with, like you said, C3. And then the lamina. Is that bone structure right
Lamina.
there? Do a little bit more than take a break here. All right. Spinous process always points to the back. Main part is the body. Transverse processes always point to the side laterally. You have the superior articular facet. This is one of the cervical vertebrae. It doesn't say which one. You can see how the frame is starting to get smaller there. It's starting to look more like a vertebrae rather than a circular disc, like your axis and your atlas. Okay, you have an inferior articular facet. If this were C7, the last cervical vertebrae, what vertebrae would the inferior articular facet articulate with?
T1.
T1. Perfect. First thoracic vertebrae. Yeah. Okay. There's a body, the pedicle, the superior articular facet, just talk about the lamina and the columns. Okay. You got that. Okay, side view of it. Okay, you still see the body of it.
Body.
You see the transverse process
Transverse process.
coming out of it with its foramen, the inferior articular process,
Inferior articular process.
and the superior articular process.
Superior articular process.
And then the spinous process,
Spinous process.
which always points posterior. Okay? But you're always going to have a superior articular process and an inferior articular process. The superior articular process articulates with the vertebrae above it. The inferior articular process is always going to articulate with the vertebrae below it, going down the spinal column. Okay, cervical vertebrae also. See the spinous process points straight at you.
Spinous process.
The superior articular facet
Superior articular facet.
and the interior articular
Inferior articular process.
and the transverse process,
Transverse process.
which points to the sides. All right, thoracic vertebrae. So now we're down to the thoracic vertebrae. The thing with the thoracic vertebrae is every thoracic vertebrae has a rib attached to it. T1 through T12, you've got 12 ribs. So every thoracic vertebrae will have a rib attached to it. Now, whether it's a true rib, whether it's a false rib, whether it's a free floating rib, it all depends on what rib that we're talking about. We'll be able to identify each of those. By the time this is done, you would tell me that true ribs are T1 through T7. False ribs are T8 through T12. Free floating ribs are T11 and T12. Okay. If you look at the thoracic vertebrae, and we'll just go through this one, then we'll take a break till 8 o'clock. Give you a chance to get some snacks and everything else. You have the lamina, you have the spinal process.
Spinous
The
process.
spinous process always points posteriorly. The transverse processes always point
Transverse process.
laterally to the sides. The superior articular
Superior
forces.
articular facet.
Okay. If this is T1, what vertebrae does the superior articular facet articulate with?
C7.
C7. Perfect. The last cervical vertebrae. Got it. Vertebral foramen. Okay, look at the difference now.
Vertebral foramen.
Look how small this is getting. I mean, it's not real small yet, but it's small compared to a huge hole in the atlas and the axis. As you go down the spinal column, it's narrower and narrower. So by the time you hit those lumbar vertebrae to look at, you can see where spinal stenosis can start to affect those nerves a lot more. That's why most of the problems are in your lumbar vertebrae as you age. That's where most arthritis is going to occur because that's a smaller foramina. You have your costal facet where
Costal facet.
where the ribs attach your costal bones. So we're talking about vertebrae. This is a thoracic vertebrae. Okay, same principles, it's just larger than the cervical ones. Starting to get more pronounced in their different structures. So again, you got your superior articular facet. Oh, I can do it without the. Oh, now I can do it without the noise. I didn't know I could do that. Okay. Superior articular facet. That's a thoracic. This is your thoracic vertebrae, articular the vertebrae above it. Your transverse process always points out to the sides. This is your transverse costal facet. Costal is your rib attaches to it. Because remember, every thoracic vertebrae has a rib attachment to it. Spinous process points laterally. Inferior articular process articulates with the vertebrae below this one. Costodema facet, the body, the costal facet where the rib attaches. Okay. Okay, looking at again, your superior articular process or facet. Your transverse process, your inferior articular process, your spinous process, which always points posteriorly, and the lamina of the bone. Doing advance it from that. Pretty good. All right, body of the vertebrae. Now we're getting to the lumbar vertebrae. Okay, now look at the lumbar vertebrae. Look at the vertebral foramen. Look how much smaller it is than the axis, the cervical, and the thoracic. So you can see with spinal stenosis, like the question was brought up, as that starts to get smaller, that's going to impinge upon your nerve. That's where the lumbar vertebrae are usually the ones that they have to fuse and have to worry about because that's where the spinosis starts to occur. But you can easily see the body of the vertebrae, the pedicle. You can see the vertebral foramen. You can see the inferior articular process, the spinous process, and the lamina, the transverse process, and the superior articular facet. Same points we brought about in all the other ones. Okay, this is a side view of it, lateral view. Okay, we can make it bigger. Good. The superior articular facet process or facet, the pedicle, which connects the body of the vertebrae, the inferior articular facet or process, the spinous process, and the transverse process. Okay, same ones we've been dealing with. Okay, lumbar vertebrae, again, looking at it from the posterior view here. The superior articular process, this is the body. Okay, the spinous process, which points directly to the back, posteriorly. Inferior articular process, and the transverse process. Again, same covering, same names. This is the posterior view, which I guess doesn't have you. There we go. Okay, this is looking at, this is the transverse processes. Remember, they point posterior on all vertebrae. Okay, this is your spinous processes and your transverse processes, which point laterally to the sides. So your spinous processes are always pointing straight back along your back, always point posterior. Your transverse processes always point laterally to the sides. Okay, the intervertebral foramina. Okay, where the spinal column runs through. Okay, that's the arch, the upper arch, the superior arch, the inferior arch that forms your intervertebral foramen. The intervertebral discs, okay? Remember, those are not fluid-filled discs. Okay, they're cartilaginous pads. They're solid cartilage that provides cushioning between the vertebrae of the spinal cord. And then you see your spinous processes pointing posteriorly. Okay, again, transverse processes point lateral. Spinous processes always point posterior. Okay, these are the curvatures we talked about. You see your spinous processes again, your intervertebral foramina, okay, where the spinal cord runs through, okay, and your intervertebral discs. Remember, you'll see you'll see questions on your nursing exams or in class. These are not fluid-filled discs. Okay, you can't puncture them and fluid runs out. Okay, they're cartilaginous pads. They're a pad of cartilage tissue that offers cushioning between the vertebrae. They're not liquid-filled. Oops, there we go. Again, this is your lumbar vertebrae. Lumbar vertebrae is L1 through L5, the transverse processes and the spinous processes. Okay, you can see the curvature, the lumbar curve. Okay, you can see it really good right here. You see you see the cervical curve, the thoracic curve, and your lumbar curve, and your sacral curve. Those curves allow you to balance and to walk. Okay, allows everything to allow your muscles to be able to control your movements. Again, so your intervertebral discs, your intervertebral foramen, and your spinous processes. Okay. Okay, the sacrum and the coccyx. The sacrum is composed of 5 fused vertebrae. The coccyx is composed of anywhere between 3 to 5 vertebrae, depending on the person. Now, on the sacrum, you have the sacral promontory, which is the top ridge of it. You have the ala, which is the side, on the lower side of both sides of the sacrum. You have the sacral foramina. Okay? So you have transverse lines, which runs across between the sacral foramina. And you have the apex, which is the tip here. And then you have the coccyx, which is your tailbone. Right? Again, this is the sacrum. This is the coccyx below it. You have your auricular surface here. And you have the median sacral crest. That's a rigid bone that is dead center, median line in the sacrum. You have medial sacral crest and you have lateral sacral crests on the sides. But the medial sacral one is going right down the midline. And again, you have your apex, which is at the tip of it. And then your coccyx bone. Okay, so looking at the sacrum, you have the body. You have the sacral canal, which is the opening that the spinal cord runs through. You have the median sacral crest, which right down the midline. The sacral hiatus, which is the opening, okay, where your spinal cord exits. You have the coccyx bone, which is 3 to 5 fused vertebrae. You have the sacral foramina, the ala, which is the side, the lateral sides of the sacrum, and the superior articular fossa. Now, this articulates with what? What bone does the superior articular fossa of the sacrum articulate with?
L5.
L5, perfect. Those are the vertebrae right above it. You get your cervical, your thoracic, your lumbar, your sacral, and your coccyx. Perfect. All right. We're good. Any questions on the vertebral column there? Let's go do our quiz. All right.
As we make our way to the quiz, I had a question on the Chapter 7 assignment.
Okay.
The last module has us doing physiology on that assignment. Question 28, I believe. It has us go to another module, I guess. And it was talking about, I can't remember what it was, but it was like ATC and like acetylcholine or something like that.
Acetylcholine, ACH.
Yeah. It was having, it was, and then like the synaptic cleft,
right.
Things like that. Things we had never talked about.
We're going to. That's part of the nerve course when we get into nerves.
Okay. I didn't know if that was part of physiology with that.
That might have come a little early then, because we will get into the synapse with ACH and acetylcholinesterase and different types of poisons that act on the body that they influence your nerves, tetanus, things like that.
Okay.
But that just might have been, it's just a little bit early, but we'll get into that.
Okay.
But if you have problems, let me just email me. I'll let you know if you need help with it, because we haven't got to it yet.
Okay.
All right. Perfect. I'll double check that one. It's number on chapter assignment 7, number 28.
It was the very last. Yeah, it was. I believe it was question 28. It was the last.
Okay, I'll double check it too. All right. Perfect. And let's go to quiz. See what you guys remember. What structures are highlighted?
Sacrum and sacral curvature.
Okay. I'll agree with that. Correct. Because remember, the first one is your cervical, then your thoracic, lumbar, and your sacral curvature. Okay, this is your vertebrae. What structure is highlighted? This is it separates the spinous process from the transverse processes.
Lamina.
Lamina?
Yes.
Lamina. Perfect. You got it. Number 3, what structure is highlighted? What is that process?
Spinous process.
Spinous process.
That's the spinous process. That always extends posteriorly. Perfect. What's highlighted there?
Lamina.
That I would say would be the lamina. Got it. Number 5. Okay. This is first of all, what bone is this?
Sacrum.
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 And this is what?
Median sacral crest.
Yep.
Median sacral crest. Perfect. Okay. It runs right down the middle of the sacrum. You look at a flat view of it, straight on view. All right, looking at that, that is what structure is highlighted there.
That is is it the superior articular facet?
I would say so. Could be the inferior, but it depends on how you're looking at it. But I would say the superior one. Yep, superior articular facet.
I thought the inferior was the bigger one right below it.
No, the inferior is on the other side.
Okay.
See, you're looking at the top portion because they could have turned it upside down on you. It's hard to compare. You see what I'm saying? If you're looking at the top part here. But if you flip this upside down, then it would be the inferior articular facet. Because when it connects like stacking. So the superior part's on the top part, inferior facet is on the bottom portion of it. Does that make sense? Okay. This is where those little openings there.
Intervertebral
Intervertebral foramen. Right? Got it. And what structure is highlighted here?
Spinous process.
Spinous process.
Man, if I'm doing good on this quiz, I better be doing good on my other quizzes.
Right, you should be. As long as you ask about the occipital bone, you're in good shape. All right, so what structure is highlighted here? The median sacral crest, the sacral canal, the body, or the superior articular fossa? The body. What bone is that?
Sacrum and coccyx.
And that's the coccyx right below it. Got it. Perfect. Okay. This is the
spinous process.
spinous process. Points to the back. You can see articular faucets right here. Your superior articular faucets, it looks like. And 11. What's that highlighted structure?
The
Spinous process.
yeah, spinous process.
Looks like the spinous process to me too. They like the spinous process on here, don't they?
There's different angles of it.
I know they do. Oh, thank you. I got some neat. I won't.
Transverse process.
That looks like the transverse process. It's kind of coming out. It's not a great picture of it, but I would say the transverse process also. Yep. All right. Look at that one.
The body.
That's what they're pointing out. But okay, the spine is a transverse. That has to be. Looks like the body. Yep. Perfect. And what structure is highlighted there? What part of the vertebrae is that?
Lumbar.
Lumbar curvature.
Lumbar curvature and vertebrae. Got it. Okay. Look at that one. That's your cervical vertebrae. What are those?
The transverse process.
Yeah, that's what it looks like. They point to the sides because here's your spinous process. These are your articular faucets. This is your body. There's your vertebral frame in here, and this looks like the transverse processes. Yep. And what bone is highlighted there?
Sacrum.
Sacrum. Got it. And what connects that between the two? Basically, the side here, wait a minute, let me read the question. It says, what feature is unique to the highlighted structure of the pictured vertebrae in that it is not found on other vertebrae? So where's the question?
The spinous process is bifid.
That means there's two of them. Surface structure of muscle attachment. The spinous process is bifid. Yep. It branches into two parts and allows rotation of the head. All right, what is a feature unique to the highlighted vertebrae? I don't think we really covered that. But again, this one, you can figure this one out by looking at the answers. This is how you take your exams for nursing also. If you don't know it, okay, what is unique to that area? A transverse foramen. Do all vertebrae have a transverse foramen?
Yes.
Mm-hmm.
Yeah. Spinous process, body. The only one they don't have would be a superior and inferior adenofossa, right? That's incorrect. Transverse foramen. I would have said adenofossa, transverse foramen. What is a feature unique
on page 163 of the book,
right?
it says unique anatomical characteristics of vertebrae C1, atlas and axes, and one of them is transverse.
Transverse foramina.
Yeah.
What's unique to the cervical vertebrae is the transverse foramina. Perfect. Which of the following structures directly articulates with the highlighted structure? To the side coming into. So look at the structure. What would articulate right into this region?
The ribs.
Costal rib, the head of the rib, the neck of the rib, articular tubercle of the rib. I would say, what part of the rib?
The head.
Okay, head of the rib. Your tubercle of the rib feeds into that. The head would come up to here, and the articular tube would feed that way. As we get into the structure of the ribs, we'll do a little bit more. That's on the next section, basically, too. So we'll get into that on the next session. We talk about the thoracic cage. And which of the following muscles originates on the highlighted structures of lumbar 1 through 5? We have not gone over this, so I wouldn't expect you to know that. But if you had to take a guess, what would you guess?
Spinalis.
What? Spinalis?
Yes.
It's the longissimus. Like I said, we haven't
that
gone
one.
over that one yet, so I don't expect you to know that one yet. We haven't gone over the muscles at all. All right. Oh, don't miss that. All right, thoracic cage. Last one. This is your anterior view of the thoracic cage. Let's show our labels that they want. All right. Look at the different bone structures here. Let's start with the clavicle. Clavicle is your collarbone. It connects the scapula with the sternum. Those are your collarbones. Okay. Coracoid process is where the clavicle connects to the part of the scapula. We have the sternum. We went over the different parts of the sternum already, right? The manubrium, the body, xiphoid process, and the
Jugular notch.
jugular notch. Yeah, I was trying to draw on the blank there. All right, perfect. You have costal cartilage of the true ribs, where they connect. And you have the costal cartilage of your false ribs. Not yours. Okay. You have rib number 1. You have the acromion process of the scapula. You have rib 2, rib 3, rib 4, 5, 6, and 7. And you look at all those ribs, rib 1 through 7, come off the thoracic vertebrae and connect directly to the sternum. That's what they're called ribs. Rib number 8, 9, 10, and 11, and 12. Okay, they do not connect directly to the sternum. This is rib number 8 right here. Okay. You see where the cartilage comes up and it connects to rib number 7. It does not connect directly to the body of the sternum. That's a false rib. So 8, 9, 10, 11, 12 all do that. Now 12 and 13, if you look at rib 12, I'm 12 and 13. Rib 11 and 12, I'm sorry. 11 and 12 are your free floating ribs. They don't even connect to the other ribs. They just end out in space. So ribs 1 through 7 are your true ribs. Ribs 8 through 12 are your false ribs. They don't connect directly to the sternum. And ribs 11 through 12 are floating. Okay, and this is thoracic vertebrae number 12. Right below that is lumbar vertebrae number 1. Okay, so thoracic vertebrae is T1 through T12, T1 through T12, and each one has a rib that connects to the the vertebral column. Remember, ribs 1 through 7 are your true ribs, 8 through 12 are your false ribs, 11 and 12 are your free floating ribs. You can see how they are there. Posterior view. You can see your first thoracic vertebrae. Don't touch. Okay, that's where your first rib attaches, and then you can see your true ribs. Okay, T7, rib 7, and then the false ribs, ribs number 8 through 12. Okay, you can see your floating ribs, your free floating ribs. You can see your scapula, and connected on that, you can see the clavicle. The clavicle connects the scapula with the sternum. Okay, this is T12, which is the last thoracic vertebrae, where the 12th rib is attached. And this is L5, which is the last lumbar vertebrae, L1 through L5. Okay, this is your sternum. You can see the jugular knots up at the top here, down there. Okay. You can see the clavicular knots. This is where the clavicle, or the column, attaches to it. This is the manubrium. This is the top portion of it. This is the sternal angle. Okay, between a body and the manubrium is the sternal angle. Then the body, okay, of the sternum, and then the xiphoid process, which is the tip of the sternum. And this is the rib. This is what we were talking about before. The rib has a head and it has a neck. It has a costal angle, which is what makes the angle, and then it has the body. This is the rest of the rib. Then it has an articular tubercle and facet. This part here is where it attaches to the vertebrae. Okay, so the head and the neck attach to the vertebrae. The articular tubercle attaches, and the body wraps around, protects your case. And if it's a true rib, it connects to the sternum. Okay.
Thank you.
Right, looking at a different angle, the inferior view of it. Again, you have the head and the neck. Okay. There's your head, the rib, then the neck, then the articular tubercle, the costal angle, which is where it converts into the body, and then you have the body of the rib there. And you have the costal groove where your blood vessels and nerves run along the rib, each rib. That's where your blood vessels and nerves run through there. All right. That was a quick one though, but let's do the quiz. What is the highlighted structure called?
Manubrium.
That's the manubrium. Perfect. What structure is highlighted here? What part of the rib is that?
The head of the rib.
It's the head of the rib. Right. What structure is highlighted?
Coastal cartilage of false ribs.
Yeah, false
Okay.
rib.
I'll buy that. How do you know they're false ribs?
They're not attached to the sternum
Perfect. They don't attach to the sternum.
directly.
Right. You got it. And what's highlighted there? What part of the rib?
The neck.
The neck. I would agree with that. And what structure is highlighted? What connects the manubrium and the body of the sternum?
The sternal angle.
Sternal angle. Okay. Which bone is highlighted? What is that bone?
Scapula.
That's your scapula. You got this part down pat. Okay. What structure is highlighted there?
The clavicle notch.
Right. That's where the clavicle is attached to the manubrium. That's your clavicular notch. Which bone is highlighted?
Vertebra 1.
Thoracic vertebra 1.
Yep, because it's not the 12th one. The 12th one's right down here. Can you see my mouse moving?
Yes.
Yeah.
So this is where your thoracic vertebrae 12 is. Your free floating ribs are 11 and 12 right down here. I can make it move right there. And your lumbar vertebrae number 5 is right down here. Okay, so it has to be thoracic vertebrae number 1. Yep. Number 9, which bone is highlighted? Rib
7.
Okay, this is the one. Is it connected? Yeah, it looks like it goes right connection to the last rib that connects to the sternum. So it looks like rib number 7. Yep, perfect. What bone is highlighted?
The sternum.
Sternum. That's your breastbone. That's the one weightlifters break when they're doing the bench press. And they try to bench like 250, 300 pounds and it slips and comes out of their chest. Or you ever see those weightlifters that bounce it off their chest? When they're doing bench presses, yeah, that's the bone they break when you do a lot of bouncing. Not supposed to lift weights that way. Number 11, what structure is highlighted?
Acromion?
It looks like the acromion of the scapula. What it looks like. Yep. You got it. Which bone is highlighted?
The clavicle.
Clavicle. What's another name for it?
Collarbone.
Collarbone. If you break that bone, do they usually do surgery on it?
They can if it's bad enough.
It can, but it's usually not because of it's got a very poor blood supply in that area. They usually don't. If it's bad enough, you're right, they do, but they usually leave those alone and let them heal. So answer correct. What structure is highlighted there?
The coracoid process?
This is the coracoid process of the scapula. Yep. And what is that?
Jugular notch.
Jugular notch. Okay, the jugular notch is the very tip of the manubrium. And what structure is highlighted there?
Ribs.
True ribs.
Those look like true ribs to me. Yep. Got it. Perfect. Now you know that and the occipital bone, right? All right. What structure is highlighted?
Angle.
What that?
Costal angle.
Well,
Costal groove.
The angle is a point where the head and neck and the acromion turn into the body. But this looks like it's highlighting here, let me turn off the highlight. And you see this, it looks like it's a groove right here.
Okay.
That's what it looked like to me. It looks like it's under on the costal groove. The costal angle would be a smaller point. Yeah, this is the groove. See, if it was, see where the white line's pointing? If it was just that area, that would be the costal angle. Because the angle is where the body meets the head and the neck. Okay, that's the costal angle. The costal groove. Okay, what does the costal groove contain?
Nerves and blood vessels.
Hmm?
Can you hear me when I talk or no?
Yeah, now I can.
Oh,
What'd you say?
Nerves and blood vessels.
Perfect. Nerves and blood vessels, arteries and veins. Got it. That's your costal groove. All right. Which of the following ligaments attached to the highlighted structure? We have not done that yet. So you look at this is the neck. You have the radial ligament, the anterior contravascular of the ligamentum, or the transverse ligament of the scapula. Okay. What would you guess?
Would it be the transverse?
Transverse ligament of the scapula? No, it's the anterior costotransverse ligament. We haven't done that yet. I won't hold you to that yet. Okay. Which of the following muscles insert on higher structures? Again, we have not done the muscles yet. You have the pectoralis minor, the long head of the biceps, the coracobrachialis, or the short head of the biceps. And it is the pectoralis minor that attaches right up in here. The acromion of the scapula.
A lot of people don't know that there is a minor and a major.
Was that?
Oh, I was just saying a lot of people don't know that there is a pectoral minor.
Yeah, pectoralis major and pectoralis minor. Like I said, we have not done the muscles yet. I think it's coming up in the next couple of chapters. but we will get into those. Which of the following structures can be found running within the highlighted structure? Okay, what is a highlighted structure?
The costal groove.
Costal groove. What runs in a costal groove?
Blood vessels and nerves.
Perfect. Intercostal, within the costal vessels and nerves. Okay, that one we should know. And the highlighted bone articulate, this one you should know too. This is not muscles. The highlighted bone articulate to which two bones?
Sternum and scapula.
Sternum and scapula.